my name is Stacy Soappman, one of the ASPIRE faculty members, and today we're going to do a quick video on a weight-bearing assessment of the foot and ankle. So I would use this when a patient comes in and they're complaining of any kind of foot and ankle pain, just to get a general feel for the mobility or lack of mobility of their foot and ankle region. So that's what we're going to look at now. If the patient come in shorts or roll their pants up above their knees, I need to be able to, or I like to be able to see their knees as well. So they feet facing forward, things like that. First thing I do, I just have them do a squat. Go ahead and squat down for me and go back up. And what I'm looking for is, does that knee track over the third toe? Okay. If it's not tracking over the third toe, where is it going? Are we seeing increased varus, increased valgus? More often than not, I see increased valgus of the knees as they're squatting. And I'm trying to think in my head, so what could be causing increased valgus? Well, a lot of the times it's due to hip weakness. So I'm not going to worry about it right now, but I'm just tucking away in the back of my brain. I probably need to go look at the hip as part of the foot and ankle assessment. The other thing I look at is, go ahead and squat again for me, please. And am I seeing symmetrical dorsiflexion in the talocrural joints? Back up for me, please. If I don't see that symmetrical talocrural dorsiflexion, I'm asking myself, why am I not seeing it? Is there a history of trauma to substantiate the lack of dorsiflexion? If there's not a history of trauma, what else could be causing that decreased dorsiflexion? Well, it could be coming from the low back or the hip, or I have a poor motor control of the talocrural joint. And so once again, I'm tucking away. I probably need to go further up the kinetic chain at some point during my examination. If there's no history of trauma to substantiate either the increased valgus with the squat or the decreased talocrural dorsiflexion. Next thing I'm going to do, have them stand. I want you to keep your feet planted and twist your whole body to the right. All right, and now twist to the left. And what I'm looking for here is, come back to the center, is does their foot rise and fall? Do we pronate and supinate through this foot here? So we start off looking at their standing posture. Do they have symmetrical arch formation on each foot? And then as they rotate from side to side, I'm looking to see, do we move in and out of pronation and supination? A lot of people come in and they say, I have flat feet. And a lot of people do have flat feet. What I'm concerned about is that a rigid flat foot or is it a mobile flat foot? And this test helps start to determine if it's rigid or flat. So can they come in and out of that pronation and supination? So the last thing I do, facing them, go ahead and go up on your toes for me, please. And I look, do we just get this nice varus formation of the foot? And down for me, please. Go ahead and turn around. I'm going to look at the same three things from behind. Go ahead and squat for me, please, and back up. And once again, I'm looking for symmetry between the sides. Here I'm looking at the calcanei, and I'm trying to see, do they both do the same thing? Because everybody's range of motion is different. It is specific to that person because we have flexible and we have rigid body types. So I'm always looking for the outlier. Does what I'm seeing here match the rest of his body type, and does it match the other side? So staying in that position with your feet planted, please turn your body all the way to the right. I'm looking to see, do I get my calcaneal varus and valgus, or inversion, eversion, however you want to think about that. Now turn the other way. And did the position reverse itself? Good. Back to the center, and now go up on your toes for me, please. Okay, and back down. So what I find here in my weight-bearing assessment, if I found things in the foot and ankle, such as the decreased talocrural dorsiflexion, or let's say that one foot couldn't come up into that nice, the arch rise position, why not? All right, so I'm thinking the why, but I'm also thinking I need to look at that in a non-weight-bearing position. So the purpose of this standing functional assessment is to help drive where I'm going to go next during my examination process. So I need to go in and do a more detailed assessment of that talocrural joint or of that midfoot region to see, is what I saw in this weight-bearing position matching what I find in a non-weight-bearing position, which is then going to help drive my treatment for a mobility versus a stability type tract. So thank you for joining us. If you have any questions, we'll take it in the comments section below, or you can check us out on our website.